Hi everyone, this is my second video on what caregivers of loved ones with fetal alcohol spectrum disorder would like mental health professionals to know when they send their loved ones to therapy. I'm Dr. Maud Champagne. I specialize in FASD, attachment, and adoption. So a lot of caregivers shared with me that whenever they're being offered therapeutic services, based on their past experience, sometimes it can be very scary. Why is that? A lot of therapies that are very common, such as ABA, such as CBT, DBT, are often being suggested to help their loved ones with FASD. However, based on many of their experiences, these therapies, if they're not well adapted, could be harmful for their family and could be harmful to the person with FASD. The truth is, we don't have a very strong evidence-based structure to prove which therapy is actually helpful with for someone with FASD. Also, what we know is that it's a very wide spectrum. And there's a lifespan also to consider. So for example, if you are supporting a family who has a child that's very young with fetal alcohol spectrum disorder and they have some attachment difficulties as well, it could make sense to provide attachment-based therapy. And then later, when they are, for example, struggling with anxiety and CBT is suggested, and it's provided in a way that involves the circle of support, the caregivers, and it's also setting the right expectations based on their functioning and brain-based disabilities, it could make sense to provide these services. What really matters here is to provide a tailored approach to the person who has FASD and tailor it to the family situation as well and the circle of support, and to involve them, like I said in my first video. So if you would like to know more, and you can visit the CAN FASD website under the mental health section. You'll see some of the interventions that are sometimes recommended, and you'll see that there's not like a very strong body of literature to say this intervention works absolutely for everyone with FASD. No, we don't have that, but we know that there's things to be done in therapy to help improve the quality of life of people with FASD and of their loved one. Please, if you have any comments, write in the comments, and if you have any questions, reach out to me. Thank you.